track with that kind of thing. And then, as I mentioned earlier, there will be a lab there, and at no cost to patients, they can have any of these labs on this list drawn and processed. These are the most commonly ordered labs. If the nurse practitioner or your physician orders some lab work that's not on here, you can still have it drawn at the clinic, but you will be charged through your health insurance. And then finally, I mentioned the health coach. The certified health coach will be at the clinic 10 hours a week. And many of you participated in our telephone health coaching in the past. It's a similar experience, but it will be in-person, face-to-face coaching. So if you want to make lifestyle changes, you want to improve your nutrition, lose weight, manage your stress better, you can set up an appointment with the coach, and she'll help you assess your life, assess what you want to change, what you're ready to change, and help you come up with some goals, and then hold you accountable, help you remain accountable to achieving your goals. So in your handouts, you should have a copy of this slide that's titled Examples. And I think this is a good way to help you understand how the clinic might save you money and how you might choose to use it. The first example is office visit for a sore throat. So if you think you're coming down with strep and you need to have a throat culture done, in a traditional health setting, you would have to have an office visit with your physician, and then they would do a throat culture. For the dollar amounts on this slide, I use those averages from the earlier slide. So that could set you back $181, that $105 office visit and a $76 lab fee. Again, those are averages. It could be higher, could be lower, just to give you an idea. You could have the same service and the same care provided at the wellness clinic at no cost to you. Many people are on medication for blood pressure. Typically, a provider requires a patient to come in every 3 to 6 months for a checkup to renew their blood pressure medication. The nurse practitioner could help with that, could help manage the medication and provide the follow-up periodic appointments. So instead of paying $105 for each visit outside of the wellness clinic, you could save that money by going to the wellness clinic. If you have high cholesterol and you're on cholesterol medication, your physician may require you to have quarterly lab draws. Maybe you don't need to actually go see the physician 4 times a year, but he or she says you need to go to lab, have your cholesterol checked so that he can get the results and make sure everything's working for you. You could have the same lab work done at the wellness clinic and request that the results be sent to your physician and save that approximately $76 per time lab fee. So that's a situation where you might choose not to select the nurse practitioner as your provider, but you could still use the wellness clinic as the source of your lab work. You would just have to fill out some paperwork to tell them where to send the results. And if you are not a clinic patient, you do need written lab order. So if you're a Mercy patient and you want to have your cholesterol checked, you'll have to bring or have your lab order faxed to the clinic. You can't just come and say, this is what I want to have done. Another example is maybe you think you're coming down with a bladder infection and it's a Friday morning, and that's something you really don't want to ride out over the weekend. You kind of want to find out and start antibiotics if you do have one. Perhaps you can't get in to see your physician. Your only other option is to go to urgent care. Usually, in addition to the office visit charge, urgent care will provide an uptick of $35 to $45 because it's urgent care or convenient care. So you're looking at over a couple $100 between the lab work, the visit, and the convenient care charge. You could have that done at the wellness clinic at no cost to you. Something as simple as a home pregnancy test. Many women purchase those over the counter for $7 to $15 per home pregnancy test. You could set up an appointment to go in and have a pregnancy test done at the clinic at no cost. And then the health coaching I referred to earlier, these are really conservative figures here. If you were to hire a personal trainer or a certified health coach to work with you one-on-one, you would pay anywhere $25, $50 or more per hour. So there's real value to that service if you choose to take advantage of it. In addition to saving you time, the clinic's designed, in addition to saving you money, the clinic is designed to save you time. It's located centrally among all of our schools. It's on 4th Street. It would be on the same side of the street as Burger King, just adjacent to Burger King. It used to be Riverfront Learning Center. It will have both before and after school hours, so that perhaps you could schedule an appointment and avoid using a half a sick day for something that really only takes 45 minutes of your time. So on Mondays and Wednesdays, it'll open at 6:30 in the morning. And then 4 days a week, Monday through Thursday, it's open until 6 p.m. Fridays will be 8 until noon, and the second Saturday of each month, it'll be open 8 until noon. Same day and walk-in appointments are possible. I would suggest calling ahead to save yourself waiting. You could call and say, well, can I get in this afternoon and what time? You know, it doesn't hurt to make that quick phone call, but if you have to walk in for an immediate need, you could. Easily scheduling via phone during clinic hours, and once you've been to the clinic your first visit, then you'll be able to access what's called the patient portal, and you'll be able to schedule your own appointments online 24/7. You'll be able to go on and schedule an appointment, change an appointment, cancel an appointment on your own. And there should be little to no wait time. If you have a 3 o'clock appointment, you should get in around 3 o'clock. We're going to be monitoring that because that's one of the things that's very important to us. Beyond being free and convenient, there's some other things that I think distinguish our clinic from the traditional setting that would make it a nice place to seek care. First of all, you should have longer appointment times, more time with the provider. Beloit Health System and the nurse practitioner are not paid based on the number of patients they see. So they don't have a financial incentive to see as many people as possible in the course of a day. What we want is people to be getting complete care and be satisfied patients. So in having more time, the nurse practitioner can give you a more holistic approach. You might come in with a concern about a skin condition, but if you have a chronic condition, she should have time to talk to you about that. Oh, by the way, is your blood pressure medication still working for you? Or she might notice that you haven't had your pap smear in over a year and say, I see that you're behind on your pap smear, would you like to get that scheduled today? So it will give you a more complete approach to your health. It's not just episodic care. Also, you will have online access to your clinical record. Once you become a patient, you can ask for access to the patient portal. They'll give you, it's called a token. It's a long identification code. They'll check your identification to make sure for privacy purposes everything matches. You'll be able to set up an account online where you can go and see your clinic medical record, check your lab results, schedule your appointments, and also communicate with the provider. So maybe you want to send a quick email to the nurse practitioner. I'm about out of blood pressure medication. Do I need to come in and see you, or you just call in a renewal? You know, you'll be able to communicate with the provider that way, all securely. Yes?
Kelly, do we have to go there initially when this opens up and then set up an account, and then that will make it easier for us if we do become ill to just walk in, or do you suggest that we do that?
The question is, do you have to go initially to the clinic in person to set up an account and make it easier to then schedule your appointments online later? Yes, your first appointment needs to be made by calling the clinic, and the phone number is on the back of the brochure, 361-1950. Once you go to the clinic, then they will ask you, would you like access to the patient portal, and they'll give you an instruction sheet and a token, that code, so that you can go home and set yourself up for future appointments to be made online. Yes?
When it says you have access to your clinic's medical record, is that just from the point where you start seeing them, or do you have records previous?
The question is, when you have access to your clinical medical record, is it just records from the point you start seeing the nurse practitioner, or is it your previous records? The only records you'll be able to access online currently will be from when you start seeing the nurse practitioner. Now, she, via the Beloit Health System electronic medical record system, will be able to see all of your Beloit Health System records. So if you're a Beloit Health System patient, the nurse practitioner will be able to pull up, for her purposes, all of your medical records. And if you go to your doctor back at the Beloit clinic, he or she will be able to see what care you had at the wellness clinic. But the patient side, you'll only be able to see your clinic medical record. It is Beloit Health System's intent to roll out a more comprehensive patient portal in 2012 where you would be able to see more of your Beloit Health System records, but that won't be ready when the clinic opens. And then one other thing, because the exception is if you have lab work drawn that goes beyond this list of free labs, then you would get an explanation of benefits from First Choice because it would run through your health insurance. But assuming that you go for an office visit, the only lab work you have done is on the list of commonly ordered labs, you won't receive any follow-up paperwork in the mail, you won't receive an explanation of benefits. So that just takes a little bit of work away from you at home. I know that those EOBs can stack up on your counter if you have a lot of care, but since it doesn't run through your insurance, you won't receive those.
Kelly, can they do yearly physicals? So besides the PAP and the mammogram, I mean, instead of going to my own physician, can I go to this nurse practitioner?
Yes, the question is, do they do yearly physicals beyond a PAP and breast exam? And the answer is yes. You can have your annual physical done at the wellness clinic.
I have a question about that because we were told that with our insurance that preventive medication or preventive visits didn't go towards your deductible or that they were paid for through the insurance. So my understanding would be that if I went for my yearly PAP exam and everything at the clinic with my regular doctor, that I wouldn't have to pay for that out of my HSA because it's a preventive thing. There's not. So what would be the advantage of, since I'm not going to pay for it if I go to the clinic, if I understand that correctly, then I wouldn't pay for it here either, but what would be the advantage to that?
The question is, because preventative care is covered at 100% regardless of where you seek the service, which is true, under the federal legislation, all preventative care is provided at no cost to the patient. That's federally legislated. What would be the advantage of having some of your preventative care done at the wellness clinic? As far as a financial advantage to you, there would be no financial advantage. There would be other advantages that I talked about in terms of time and the more holistic approach, but no. Preventative care is covered at 100% regardless of where you have it done. That's why on that list of examples I gave you, those are all more acute care. None of them are annual type exams because those are covered at 100%.
Okay, and then like for the lab work, like you go to your regular doctor for your yearly physical and it's already scheduled. I could have the lab work done at the wellness clinic.